from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today's Wellness Wednesday, and Dr. Scott Davis joins us, Baptist Health Cardiologist. Dr. Davis, good morning, and thanks for taking time out of your morning to talk about this new study from the CDC talking about vaccine effects on the heart. What can you tell us about this research? I know it's something that you're following very closely as a cardiologist, but it's something that our viewers have also been following. There have been a couple news stories about this. So what can you break it down and help us understand about it?
Chris, the medical term that's popped up again is myocarditis. And like I tell my kids, always break down a word to understand a word. So myo, heart, or myo, muscle, cardio, heart, and itis, inflammation. So inflammation of the heart muscle has popped up again as we discuss COVID. You might remember back in the end of the summer last year, there was some concern about myocarditis in some athletes, NCAA athletes, NFL athletes, that turned out to be not that frequent and not that major of a concern. And as you know, we're learning more and more about COVID each day, each week, each month. And so a recent paper was published in the American Academy of Pediatricians looking at the incidence of myocarditis following COVID vaccine in that 12 to 17 age group. Now, the Pfizer vaccine is the only vaccine that's been approved for that age group of 12 to 17. And there have been a few cases, rare cases of myocarditis following the vaccine. Now, let me back up and just remind folks, this is not a new finding as far as vaccine and myocarditis. It was reported after the smallpox vaccine, for instance, and the incidence was very rare, like 1 in 10,000, 1 in 20,000. So this is a newer finding. The question is it just coincidence or does it really relate to the vaccine itself? I can tell you that based on current data, it is rare, it is treatable, and it's non-fatal. And so the thing that I tell people, and this is a bit of an editorial, but I will say this, there's a lot of messaging going on out there and a lot of mixed messaging going out there. And a lot of it's driven by this guy and it's, through social media. And so I tell people, look, you don't need to get your medical information and your medical advice from Facebook any more than you need to get investment advice from a bathroom wall, right? So I highly encourage folks that, look, if you're concerned about you getting a vaccine, if you're concerned about your child getting a vaccine, highly encourage you to talk to your physician, talk to your pediatrician. I can tell you that I think that the vaccine is helpful, and I think that it is clearly lowering reducing and lowering the incidence of hospitalizations, of deaths, and of cases across the country. And as we continue to pursue the vaccine, I think that's going to be beneficial. My kids, my family has been vaccinated. This is not meant to be telling you what to do, but I would encourage you to seek out your healthcare provider in this situation. But as far as it relates to the incidence of myocarditis in children, it has been predominantly in males, 16 and 17-year-old males. But again, rare incidence, very low risk here, and it has so far been treatable.
All right, Dr. Davis, thanks for explaining that all today and keeping us informed. We appreciate all that you do at Baptist Health. If you'd like to talk with your doctor, if you'd like to talk with one of the great cardiologists over there at Baptist Health, you can go to baptist-health.com or call the number on your screen. Dr. Davis, we'll see you next time. Thank you again.
Thanks, Chris.